So today we are going to be doing something on phlebotomy, and even more specifically venipuncture. You have to consider some things. You have to consider the purpose for the intravenous inversion, duration of therapy, how long are we going to take when we are doing our procedures. The integrity of the surrounding tissue is so important, since you should avoid areas with skin breaking, rashes, things like that. The size of the vein and the integrity of the vein, and you must always know that the bigger one is not the best in this situation. And you also should choose a non-dominant hand if possible, so that you allow the child to play normally and do other things. So if he's left-handed, you go for the right. If he's right-handed, you go for the left. And the patient diagnosis is also important to consider. You should consider if it is a sickle cell patient. In sickle cell patient, we avoid the joint areas. So let us do something on the vein selection. So as I said earlier, the biggest vein is not always the best. Hard and bumpy veins are not healthy. You avoid sclerosed and thrombosized veins. Avoid areas that the valves are palpable or where two veins meet. You should always look for straight veins. Before you consider the proximal sites, you should always go for the distal sites to preserve the vein integrity. The possible sites to start an IV. So we have what we call the dorsal metacarpal vein on the back of the hand. The dorsal metacarpal vein on the back of the hand. The veins are usually superficial and palpable and visible. The hand can be easily restrained during the procedure and comfortably splinted. So the next vein we go for is the cephalic vein, or the medial site of the wrist. These veins are usually large and palpable, but they are not usually visible, and their detection can be quite difficult when we are dealing with a child. So we can also go for the basilic or cephalic vein in the inner aspect of the elbow. They are best for blood sampling and short-term infusion. For example, if you just want to run an infusion for some minutes or a normal saline for a short period of time, you can go for the basilic veins. So you will require to splint so that you immobilize the child. It also poses a risk in infiltration due to movement. This child should be used with when no other site is available for administration of IV. So we also have the basilic or the cephalic veins in the upper arm and the shoulder. They are palpable and visible. They require minimal splinting and must be carefully monitored. Those are some of the sites we can go for. We can also go for the basilic branch veins in the inner wrist, or marginal veins in the ankle or the foot. We can also go for the ankle or the foot, and we call that the symphysis vein, it's also called the ankle vein. It is actually a large vein and an excellent site for IV. The marginal veins are visible and easily stabilized. Then we can also go for the scalp vein. So the superficial or temporal vein in front of the ear, or the posterior or aurenical vein behind the ear, the frontal or metopic vein from the forehead, or the occipital vein at the back of the head. So these are just some of the sites that we can go for when we want to do scalp vein. Scalp vein are superficial. Superficial means located near to the surface. We have to dilate the vein. Dilation means actually making the vein visible, more visible. So some of the hints that you can use to make the vein more visible: you can gently tap the vein. Just tap it. If you see a vein, you gently tap it, like tap tap tap. You can have the patient open and close the hand just gently. You place it in an extremely dependent position, like it has to be dependent. And you can also warm the site. By warming the site, actually, you know that when the temperature of the body rises, your veins actually dilate, and when they dilate, they become more prominent and more visible. So you can warm the site using a very warm diaper or hot tap water. Not very hot. Don't remember not to burn the baby with the spirit of looking for the vein, and you end up burning the baby up. So there is the needleless system, or you can use an extension set that is always added to the peripheral IV. You can use protective devices for cannulation. So let us see how we will prepare for the IV or phlebotomy. So remember, you are dealing with a child, so you can call the child life, the carer, for pre-procedural teaching. You just tell the child care holder that this is what I'll be doing. I'll be doing 1, 2, 3. This actually helps in a brief developmentary and appropriate explanation. Actually, setting up equipment before the child is can sometimes lead to the child developing anxiety. The child can be so anxious, so it is always good you set up your equipment before you actually go for the actual procedure. So when possible, you can have the child in a position that is comfortable rather than laying them down. You can have the child in a position that is very comfortable and secure, and the infant should always be supine, but a child older than 12 should be kept in a semi-inclined position. You can have the parent to comfort the child, and another healthcare professional to stabilize the child. Lighting is so important when you are doing phlebotomy or cannulation. Lighting is very, very important. You can have distraction tactics ready. For example, a video. You can have a video to distract the child. Distraction kit. You can have bubbles, a spy book, anything that can just distract the child. You can give the child a choice. For example, you can tell the child, would you like to sit on the bed or on your mom's lap? You're just making the child feel more and more comfortable before you begin the process. So actually, we'll go to the next part, that is the pain management, like a topical anesthetic cream. And you must always remember to provide psychosocial support along with the topical anesthetic. You can also use 24% sucrose. If you consider giving a 24% sucrose on an anterior part of the tongue for 2 minutes before the IV. Children love sugars, so when you give them the sugar, at least this will manage the pain and it will distract them. So when you are actually doing the intravenous insertion, so the first thing that you will do the cleaning. You clean the skin with antiseptic for 30 seconds. Then you allow it to dry. 70% alcohol. You can use your antiseptic of choice. The second thing you do, you must visualize the brain just before you insert the IV catheter. You may want to have one last feel, like you touch above where you plan to put the needle or the catheter, and you must be very careful not to contaminate the area you want to insert. You have to stabilize the vein by stretching the skin below the chosen site. So you stretch the skin below the chosen site. This helps in stabilization of the vein. and you enter the vein in a 10 to 30 degree angle, dependent on the depth of the vein, but you must enter at a 10 to 30 degrees angle. Once you see blood return, you stop. So once you insert it and you see that the blood, there is a backflow of blood, you must stop there and lower the needle and advance slightly. So that actually means at this point you are inside the vein. So once you see there is some backflow, you stop there and you lay down the needle, you lower the needle in an advanced slightly to ensure the catheter just got into the vein, and you insert it extremely just slowly. Remember, the speed has to be slow. You have to press on the cannula tip to prevent backflow. So once you insert it, you press on the cannula, because if you don't press on it, there will be some backflow and you can mess up. You can mess up with the blood. You have to apply an appropriate extension set. You have to dress the catheter hub. So as you do all this, you must try to use a positive language as much as possible. Remember, you are dealing with a child, and instead of telling the child don't move, you can tell the child now it is this time to hold still, just politely. And you can also encourage the child by telling the child, you are doing a great job, you are doing a great job. And you must try to have the child to focus on the distraction as much as possible. You don't have the child to focus on the procedure that you are doing. Just try to have the child focusing on the distraction as much as so I'll pass with you some of the phlebotomy tips that you can actually follow. So first of all, to avoid hemolysis, you must not leave the tourniquet longer than 60 seconds. This will cause a localized stasis, and the hemo concentration and infiltration into the blood tissues can occur. This can actually lead to something called hematoma when you leave the tourniquet for too long. This can affect the protein, hematocrit, and all those cellular components. Like all those cellular elements can be affected when you leave the tourniquet for too long. When you're using a syringe, you should avoid the plugger back forcibly. For very small veins, downsize to 3 or 5 ml syringe when withdrawing blood. Larger cc's of syringes, like 10 cc for smaller veins, this can actually lead to collapsing of the veins, especially when you're dealing with a child. And you should always decrease the amount of pressure. When you pull back so fast, the vein will always collapse. You might be in, but you don't obtain any blood from the vein. Why? Because the pressure that you are pulling out with is too high, and this makes the vein to collapse. So you should just be gentle. You maybe use 3 ml or 5 ml syringe for smaller veins. Collect the necessary volume of blood to the type of macro or micro tube that you are using. You must allow the antiseptic to dry before you access the vein, a minimum of 30 seconds. These antiseptics dry at a relatively fast rate, 30 seconds. When you are actually transferring the blood to the vacutainer tube, you must use appropriate blood transfer device to allow the vacuum to pull the blood into the vacutainer. Do not apply pressure to the plunger. Gently inside the tubes. You invert the tube 6 to 8 times. If this is my tube, I will invert it 1, 2, 3, 4, 5, 6. Just gently. Remember, when you shake the tube, you are going to lead to hemolysis, and you are going to destroy the cellular components in the blood. So up to there, I hope you are with me. I hope I've not lost you along the way, and I want you to take just the next 5 seconds to kindly subscribe to my YouTube channel. So in the count of 5, 4, 3, 2, 1. Thank you for doing that for me. Thank you for subscribing to my YouTube channel. So there are also capillary samples. We can also sometimes require capillary sample. This can be used to obtain small microtubes and cap gases. We take capillary samples, for example, when you want to do blood slides for malaria parasites. So you must always remember to wipe away the first drop. The first drop you must always wipe away, since it contains interstitial fluid. You can pick the outer aspect of the finger or the toe. You can always use the finger or the toe when you want to obtain capillary blood sample. You can use the heel of the baby for up to 6 months. For up to 6 months, you can always use the heel of the baby. You know where the heel is, like shown in the picture below. Gently apply pressure to the surrounding tissue, proximal to the puncture site, and release. You apply pressure, then you release. You apply pressure and you release. Let the extremely feel back and give it a 2 to 3 second break before applying pressure. If blood flows out sluggishly, you have to try a different angle. So for blood cultures, since blood cultures we majorly want to maintain aseptic techniques as much as possible. Since blood cultures should be as sterile as possible, we must clean the area or on top of the culture bottle with 2% chlorhexadiene and 70% alcohol for 30 seconds and allow it to dry for a minimum of 30 seconds. It is important to allow the top of the culture bottle to dry, as the antiseptic residue can enter the culture bottle when inserting blood, potentially killing off bacteria in the sample. So it is good you allow it to dry. You clean the skin also with the antiseptic and chlorhexadiene. Do not take from saline lock. Saline locks can actually colonize bacteria. Minimum volume for effective culture is 1 ml. Remove any air out of the syringe before putting into the culture bottle. So that is that. I will have done something on the tubes, but you can watch my other videos. I've done a video on the tubes and their uses, so you can watch the previous videos on blood tubes. So maybe what I can tell you is that these skills is something that you gain with time. You don't have to worry if you can always never aim that vein you are going for. Every time you go in, you come out with nothing. You don't have to worry. These are things you train with time, and with time you get that you have the hands-on skills. Remember, practice makes perfect, but don't hurt the patient in the sense that you are just practicing to know how to aim the vein. So that was infant phlebotomy, and thank you for staying with me, and remember to subscribe to my YouTube channel. Just hit this subscribe button right here. Thank you and bye.